If you, or someone you love, are currently taking amlodipine, losartan, or lisinopril, please don't skip through this video, because what we're about to share covers 9 things that most doctors simply don't have time to fully explain during a short office visit. These are not secrets, and this isn't about creating fear, but these are the kinds of details that can make a real difference in how safely and effectively your blood pressure medication works for you. Stay with us until the end, because some of these points, especially the ones in the middle of this video, are the exact details that catch most people completely off guard. Let's start with the first thing most people never fully understand, which is how differently these 3 medications actually work inside the body. Amlodipine belongs to a group called calcium channel blockers, and it works by relaxing and widening blood vessels so blood can flow more easily. Losartan and lisinopril, on the other hand, work by controlling hormones in the body that are responsible for narrowing blood vessels and raising blood pressure. Even though all 3 medications aim for the same goal, lowering blood pressure, the path each one takes to get there is completely different, and that difference matters far more than most people realize when it comes to side effects, interactions, and how your body responds over time. The second thing worth knowing is that these medications can affect important minerals in your body, especially potassium. Losartan and lisinopril, in particular, can sometimes cause potassium levels to rise higher than normal, a condition that, in its more serious form, can affect heart rhythm. This is exactly why doctors often recommend periodic blood tests, even when someone feels completely fine, because changes in potassium levels don't usually come with obvious symptoms until they've already become significant. If your doctor has ever asked you to get blood work done while on these medications, this is very likely one of the main reasons. The third thing that often surprises people is how sensitive these medications can be to certain foods and supplements. For those taking losartan or lisinopril, suddenly increasing potassium-rich foods, like bananas, oranges, or potassium-based salt substitutes, without medical guidance, can push potassium levels even higher. This doesn't mean these foods are bad, they're actually very healthy in general, but the combination with these specific medications requires a bit more awareness than people usually expect from their daily diet. Moving on to the fourth point, swelling in the legs and ankles is something that's commonly associated with amlodipine specifically. This happens because amlodipine widens blood vessels, and in some people, this can lead to fluid building up in the lower body. While this isn't dangerous for most people, it can be uncomfortable, and it's also one of the most common reasons people discontinue this particular medication. If you've ever wondered why your ankles seem more swollen since starting a new blood pressure medication, this mechanism is very likely the explanation, and it's worth mentioning to your doctor rather than just living with it silently. The fifth thing that deserves attention is a particular side effect linked to lisinopril and similar medications in its class, which is a persistent dry cough. This happens because of how the medication interacts with certain compounds in the body, and it can develop weeks or even months after starting the medication, which often makes people assume it's unrelated to their prescription. If you've started a new cough that seems to have no clear cause, especially after beginning lisinopril, this is worth discussing with your doctor, since switching to a different but similarly effective medication often resolves the issue completely. The sixth point is something that catches almost everyone off guard at some point, and it involves something called the triple whammy effect. This happens when blood pressure medications like lisinopril or losartan are combined with certain pain relievers, particularly common over-the-counter anti-inflammatory medications, along with diuretics, sometimes known as water pills. This specific combination, when used together regularly, has been associated with an increased risk to kidney function. Many people don't realize that something as simple as regularly taking an over-the-counter pain reliever alongside their blood pressure medication could create this kind of combined effect, which is exactly why doctors emphasize disclosing every medication and supplement you take, no matter how minor it seems. The seventh thing every senior should know relates to what doctors often call sick day rules. When you're dealing with an illness that involves vomiting, diarrhea, or reduced fluid intake, your body becomes more vulnerable to dehydration, and certain blood pressure medications, especially lisinopril and losartan, can affect kidney function more significantly during these periods. Many clinical guidelines now recommend temporarily pausing certain medications during serious short-term illnesses, but this should always be done under a doctor's guidance rather than as a personal decision, since stopping medication incorrectly carries its own risks. The eighth point is one that's often overlooked, and it concerns dizziness, lightheadedness, and the increased risk of falls, particularly in older adults. Blood pressure medications, by their very design, lower blood pressure, but if blood pressure drops too low, especially when standing up quickly, it can lead to dizziness that increases the risk of falling. For seniors, falls are a significant health concern on their own, sometimes leading to fractures or other complications. This is why doctors often recommend rising slowly from sitting or lying positions, and why persistent dizziness should always be reported rather than dismissed as simply feeling tired. And the ninth thing, perhaps the most important of all, is that blood pressure itself naturally fluctuates throughout the day and can be influenced by stress, caffeine, sleep quality, hydration, and even the time of day you take your medication. This means that a single blood pressure reading taken once during a brief doctor's visit doesn't always tell the complete story. Many doctors now recommend home blood pressure monitoring at consistent times, which can reveal patterns that a single office visit might miss entirely, helping both you and your doctor make more informed decisions about your treatment over time. Let's go a little deeper into a few of these points, because they deserve more context than a quick mention. Take the potassium issue, for example. Potassium is essential for normal muscle and nerve function, including the muscles of your heart. When levels stay within a healthy range, everything works smoothly. But when potassium becomes too high, a condition doctors call hyperkalemia, the electrical signals that control your heartbeat can become disrupted. In mild cases, this might cause nothing noticeable at all. In more significant cases, it can lead to muscle weakness, fatigue, or irregular heart rhythms. The tricky part is that mild to moderate changes often produce no symptoms whatsoever, which is precisely why routine blood tests matter so much, even when you feel perfectly fine. The swelling issue connected to amlodipine also deserves a bit more explanation, because many people assume swelling automatically means something is seriously wrong with their heart or kidneys. While swelling should always be mentioned to a doctor just to rule out other causes, with amlodipine specifically, this swelling is often simply a mechanical result of the blood vessels widening, allowing more fluid to shift into surrounding tissue, particularly in the lower legs. For some people, this resolves on its own over time as the body adjusts. For others, a doctor might recommend elevating the legs periodically, reducing salt intake, or in some cases, switching to an alternative medication if the swelling becomes bothersome enough to affect daily comfort. The persistent cough associated with lisinopril is worth expanding on as well, because it affects a noticeable percentage of people taking this category of medication, sometimes referred to as ACE inhibitors. The mechanism involves a buildup of a particular compound in the respiratory tract that some individuals are more sensitive to than others. What makes this particularly confusing is the delayed timing. Some people develop this cough within days of starting the medication, while others might not notice it until several months later, which often leads people to blame allergies, seasonal changes, or a lingering cold rather than connecting it to their medication. If you've experienced an unexplained cough that started sometime after beginning lisinopril, mentioning the timeline to your doctor can help them make the connection quickly. The triple whammy effect deserves a closer look too, since it's one of the more commonly missed interactions in everyday life. Picture someone managing high blood pressure with lisinopril, who also takes a diuretic for fluid retention, and who occasionally reaches for a common anti-inflammatory pain reliever for headaches or joint pain. Individually, each of these medications serves a clear purpose. But together, especially when used regularly rather than occasionally, they can place extra strain on kidney function by affecting blood flow to the kidneys in overlapping ways. This combination becomes particularly relevant for older adults, who may already have naturally reduced kidney function simply due to age, making this interaction worth flagging clearly with a doctor or pharmacist, especially before starting any new over-the-counter pain medication regularly. Sick day rules are another area where clear communication with a doctor really matters. Illness involving vomiting or diarrhea reduces fluid in the body fairly quickly, and when combined with medications that already affect kidney function and blood pressure, the risk of dehydration-related complications increases. Some clinical guidelines suggest temporarily holding certain medications during these short illness periods until fluid intake returns to normal. However, this is highly individual, and the right approach depends on factors like the specific medication, the severity of the illness, and a person's overall health history. The key takeaway here isn't to memorize a fixed rule, but rather to know that illness can change how these medications behave, and that calling your doctor's office during a significant illness, rather than guessing on your own, is always the safer path. Falls and dizziness deserve a bit more attention too, since this connects directly to long-term independence for many seniors. A fall that might seem minor for a younger person can sometimes result in a fracture or extended recovery period for an older adult. Because blood pressure medications work by lowering blood pressure, there's a small window, particularly right after standing up, where blood pressure hasn't yet fully adjusted to the new position. This is called orthostatic hypotension, and it's why doctors often recommend pausing for a moment when transitioning from lying down to sitting, and again from sitting to standing, allowing the body circulation to catch up before fully moving. Finally, let's revisit the idea of blood pressure variability, because this ties everything together. Blood pressure isn't a fixed number, it's constantly shifting throughout the day based on activity, stress, temperature, food, and countless other factors. A reading taken during a stressful doctor's visit, sometimes referred to as white coat syndrome, might be higher than your typical everyday numbers simply due to the stress of being in a clinical setting. This is part of why home monitoring has become so valuable, since it captures a more accurate, realistic picture of how your blood pressure behaves across different times and situations, rather than relying on a single snapshot taken under unusual circumstances. Now that we've gone through these 9 points, let's take a moment to understand why doctors often don't have time to cover all of this during a typical appointment. A standard checkup is usually quite short, sometimes only 10 to 15 minutes. And during that time, a doctor needs to review your overall health, check your vital signs, address any new concerns, and write or renew prescriptions. With so much to cover in such limited time, detailed explanations about medication mechanisms, food interactions, or long-term side effect patterns often get condensed into brief instructions rather than full explanations. This isn't a reflection of poor care, it's simply a reality of how modern healthcare systems are structured, which is exactly why resources like this video exist, to fill in some of those gaps with clear, accessible information. It's also worth understanding why these 3 medications in particular are prescribed so frequently. High blood pressure, or hypertension, is sometimes called a silent condition because it often doesn't cause noticeable symptoms until it has already caused damage over time to the heart, kidneys, or blood vessels. Amlodipine, Losartan, and Lisinopril have all been studied extensively and have strong track records in helping people manage this condition effectively when used correctly. The goal of sharing all of this information isn't to create doubt about these medications, but rather to help you understand them well enough to use them as effectively and safely as possible. Something else worth mentioning is how stress and emotional well-being tie into all of this. Chronic stress can elevate blood pressure on its own, sometimes working against the very medication meant to control it. This is why doctors often encourage combining medication with lifestyle factors like regular physical activity, adequate sleep, and stress management techniques. Medication can do a great deal, but it tends to work best as part of a broader approach to health rather than as a standalone solution. It also helps to understand how age itself changes the way these medications behave in the body over time. As people get older, the kidneys and liver naturally process medications a bit more slowly than they did in earlier years. This means a dosage that worked perfectly well for someone in their 50s might behave differently in the same person decades later, even if nothing else about their prescription has changed. This is one of the quiet reasons doctors periodically reassess dosages for long-term medications, rather than simply renewing the same prescription indefinitely without review. Pharmacists, interestingly, are an often underused resource in all of this. While doctors manage the bigger picture of your health, pharmacists are specifically trained to catch medication interactions, timing conflicts, and dosage concerns. If you've ever had a quick question about whether a new over-the-counter medication is safe to combine with amlodipine, losartan, or lisinopril, your pharmacist can often answer that question on the spot, without needing a full doctor's appointment, making them a valuable first point of contact for smaller, day-to-day medication questions. Hydration is another factor that ties several of these points together. Staying properly hydrated helps support healthy blood volume and circulation, which can influence how effectively these medications work. On the other hand, dehydration, whether from illness, heat, or simply not drinking enough water throughout the day, can amplify some of the side effects we've discussed, including dizziness and changes in kidney function. Something as simple as keeping a consistent hydration habit throughout your day can quietly support how well your medication performs. It's also important to mention that everyone's body responds differently to these medications. What causes a dry cough in one person might never affect another person at all. What causes swelling in someone's ankles might not happen to someone else taking the exact same medication. This is why doctors sometimes need to adjust dosages or switch between these medications entirely before finding the right fit for a particular person. If a medication doesn't seem to be working well for you, or if side effects feel difficult to manage, this is always worth discussing openly with your doctor rather than assuming nothing can be changed. Before we wrap up, it's important to be clear that this video is intended purely for educational awareness. It is not meant to replace personalized medical advice, and no one should change their medication, dosage, or routine based solely on information from a video, no matter how well-researched it is. Your doctor has access to your complete medical history, lab results, and personal health context, all of which are essential for making safe decisions about your treatment. If anything in this video resonated with your own experience, the best next step is simply to bring it up during your next appointment so your doctor can address it directly with you. If you found this breakdown helpful, think about sharing it with a parent, grandparent, or anyone in your life who takes these medications, since awareness like this is often most valuable when it's passed along to the people who need it most. If this video helped you understand your medication a little better, don't forget to subscribe to the channel for more videos like this.